You ever found yourself in that heart-pounding moment when your little one suddenly breaks out in unexplained rashes and spikes a fever? It's a scenario that can send any parent into a frenzy of concern. But what if I told you that this experience is more common than you might think? We'll uncover the details of the journey of the fear, the diagnosis, and the path to recovery. Could this happen to your child too? Stick around until the end, because by sharing this story, we hope to shed light on a condition that all parents should be aware of. So, have you ever experienced those dreaded rashes and fever with your little one? Stay with us to find out more. Hey there! Find out more. Hey there, everyone! Welcome back to our channel, where we bring you stories that touch the heart. Today, we have a heartfelt tale of a brave mom named Emily and her sweet daughter, Lily. They walked into my clinic, their faces filled with worry and tears. Lily's health had taken a puzzling turn, and little did they know, they were about to face a fierce enemy, the measles. In the clinic, Emily looked really concerned, tears streaming down her face. Lily was covered in rashes, and she had symptoms that felt like a bad flu. It was a tough sight to see, but I wanted to assure them that there was hope. We sat down in the consultation room, Emily, Lily, and me. I wanted to be there for them and provide the important information they needed. Emily poured out her worries about measles, how serious it could be, and what it might do to Lily. So, I began to explain. Measles is an airborne disease caused by a virus, and it's very contagious. Symptoms may develop about 8 to 12 days after you're exposed. Symptoms can last 10 to 14 days. Measles is also called rubeola, 10-day measles or red measles. It's not the same as German measles, or rubella. Measles and German measles, rubella, are similar in some ways. They have some symptoms in common, such as fever, sore throat, and rash. However, the virus that causes measles is different than the virus that causes German measles. German measles is very serious for those who are pregnant. This condition can cause the person to miscarry or can cause birth defects in the baby. Both viral diseases can be prevented by getting one vaccine. Anyone who isn't vaccinated can get measles. Before the measles vaccine was available, almost everyone got measles. If you have had measles or were vaccinated against measles, you're more likely to be immune to the measles virus. You can still get atypical or modified measles after the vaccine. The most common symptoms of measles include a high fever, tiredness, a barky cough, red or bloodshot eyes, a runny nose, a red rash, which starts at the head and then spreads downward, a sore throat. The rash starts out as flat red spots on the face and then moves downward over the body. Then smaller raised white spots may appear on top of the red rash. The spots might join together as the rash goes down the body. Measles is caused by an extremely contagious virus called morbillivirus. Measles is spread by contaminated droplets that are spread through the air when you cough, sneeze, or talk. Kissing someone who has measles. Sharing drinks or food with someone with measles. Shaking hands or holding hands or hugging someone with measles. From pregnant people to their babies, either during the pregnancy, delivery, or while nursing. The airborne respiratory droplets can remain in the room even after the person with measles is gone. It can take 6 to 21 days to develop symptoms of measles after you've been infected. This is the incubation period. You're contagious about 4 days before you develop a rash to about 4 days after the rash starts. Your healthcare provider will probably be able to diagnose measles by examining your child. However, they may order laboratory tests to find the virus in samples of blood, secretions from your nose and throat, urine, pee. There's no cure for measles. The virus must run its course, which usually takes about 10 to 14 days. You can do some things that might make you feel better, such as taking acetaminophen or ibuprofen for aches, pains, or fever. Getting plenty of rest. Drinking enough fluids. Gargling with salt water. Avoiding harsh light if your eyes hurt. There are many complications associated with measles, some of them very serious. Complications happen most often in children ages 5 years old or younger. Pregnant people. Adults ages 20 or older. People with weakened immune systems. Complications of measles include diarrhea, ear infections, pneumonia, encephalitis. This condition can cause inflammation of the brain, leading to seizures, hearing loss, or learning disabilities. There are two types of vaccines that protect against measles: MMR vaccine for children. The MMR vaccine is often given in 2 shots. The first shot is given around the age of 12 to 15 months, and the second around 4 or 5 years of age. If a child hasn't been immunized, measles can still be prevented by receiving the vaccine within 3 days of exposure to the virus. MRV vaccine. This vaccine is only available for children ages 12 months to 12 years of age. Your child should get 1 shot between 12 and 15 months. Your child should get the second shot between 4 and 6 years. However, the second shot can be given 3 months after the first shot. Pregnant people shouldn't get a measles vaccine. There may be other reasons why you shouldn't get one, such as an immune system disease or an allergic reaction to a previous vaccine. There may be reasons why you should wait to get one. The best way to prevent measles is to get vaccinated. People who work with children or who are in other industries are encouraged to avoid physical contact with sick people and to practice good hand-washing technique. The outcome is excellent for most cases of measles. Once the disease passes, you'll most likely be protected against getting measles again. In cases where there are severe complications, the outlook for long-term problems are less certain and vary on a case-by-case basis. It's believed that the rinderpest virus in cattle jumped to humans in the time around 600 BC. This virus became the measles virus. If you're pregnant and you think you've been exposed to measles, you should contact your healthcare provider. We talked about ways to protect Lily. Vaccination was like our superhero in this story. I cleared up any confusion and gave Emily the facts. I reassured her that with good care and treatment, Lily would get through this tough time. Back at home, we followed Lily's progress. With each day, her symptoms got a little bit better. It was clear that early help had made a big difference. Through this emotional journey, Emily and Lily became a symbol of the power of knowledge and the importance of getting help when you need it. Their story is a reminder for all parents to trust their instincts, reach out to professionals, and put their children's health first. As we wrap up, remember that knowledge is our strongest weapon against diseases. If you ever find yourself facing a health scare, don't hesitate to seek help, ask questions, and learn as much as you can. Thanks for joining us on this heartfelt journey today. If you found this video helpful or touching, please like, share, and subscribe for more heartwarming stories. Stay tuned.